All right, let's see. Phone lines are open, 1-866-977-4820. We lost Steve. Steve's going to try to call back. I think he was an organic farmer. Well, we'd love to hear from him. We need a lot more organic farmers out there so we could talk to him. So, Steve, give us a call back, 1-866-977-4820. You're listening to Ask the Doctor. All right, you know, one thing I kind of don't agree with that nutritional guy talking earlier in the show about coffee and green tea. Remember, everything in moderation. I think the new studies actually are suggesting that coffee may be beneficial in moderation. Half the Americans out there drink coffee. It is a powerful antioxidant. It's been shown to be protective against liver and colon cancer, help migraine headaches, type 2 diabetes, Parkinson's, and Alzheimer's. So none of us want to get that. So a couple of cups of organically grown coffee a day, I think, is actually okay for you. Green tea, maybe 2, 3, even 4 cups of green tea a day if it's organically grown. The polyphenols from green tea are very powerful, helping reduce cholesterol, all sorts of different types of cancers, diabetes, liver disease, helps you lose weight, helps dental decay. There's a lot of things that green tea are good for you. We like it because it may actually prove to help be beneficial for macular degeneration, cataracts, and diabetic retinopathy. All right, let's go back to the phones. Ed in Bradenton, good morning.
Good morning, Dr. Lange. The other day I heard you downplaying folic acid. The reason why I'm asking, maybe around 5 years ago, I saw a study published by LEF. They were using around 3,000, 5,000 micrograms per day to lower homocysteine, and they said it helps improve endothelial function. And I thought it was safe. I heard you the other day say to keep it around 200 or 300 micrograms, and I've never heard that before. I was wondering what your feeling was on that.
Yep, that's a great question. And the newest studies out there are now suggesting that too much folic acid, and too much being higher than 1,000 micrograms a day, all right, actually can be carcinogenic, especially colorectal cancer, but now they're seeing the possibility for other types of cancers. Now, I do admit, homocysteine, there are some studies, and they're fairly limited, but there are some studies that are trying to suggest that a combination of folic acid, B6 and B12 can lower your homocysteine, okay? And your homocysteine, you do not want to have elevated homocysteine because that's a risk factor for all sorts of health problems, including eye problems. So it's kind of a fine line, you know, what do you actually do? This is an area that has to be studied a little bit more, but certainly I don't want to increase our risk of cancer in our patients, and we do know now that over 1,000 micrograms of folic acid it can be carcinogenic. So I'm recommending to everybody, I think about 300 micrograms unless directed by your physician. 300 micrograms is about the maximum you should be getting in a vitamin supplement, because then you've got a 700 microgram leeway there through the foods that you're eating, so you're not going to overdo it. I absolutely 100% unequivocally think it's way too much. Unless your doctor personally put you on it, okay? Oh, absolutely, on the cancer. I've seen better studies now on the potential carcinogen than on homocysteine, believe it or not. Okay, so you can start Googling that, and you'll see some more of these studies. I know some people that are involved in some of this research, and they're going to be publishing more of these studies over the next few months to early 6 months by end of 2011. I think you're going to see some more studies that are coming out. Yeah, I've seen some controversy regarding selenium as well. Yeah, absolutely. So, thank you. You take care.
You know, folic acid is real important in pregnant women to prevent spina bifida and neurotube disorders and things like that. And even then, I think the recommended dosage for pregnant women, you know, before you're even pregnant, actually, is 400.
Right,
so.
right, 400 micrograms, somewhere around there. And you know what happened is, you know, about 20 years ago, the government mandated that we actually start to fortify our foods with folic acid.
Right.
So neural tube defects went down, but now cancer's going up. And a lot of the foods that we just mentioned are high in folate. So you get it from the natural source, not a fortified source. Green leafy vegetables, spinach, turnip greens, asparagus, legumes and beans and peas, even egg yolks. People need to eat eggs again. Liver, sunflower seeds, all of these things have folic acid in it. So we're not typically a folic acid deficient country. All right, you're listening to Ask the Doctors, Dr. Michael Lange and Dr. Cathy Dau, both of Lange Eye Care and Associates. Remember, we do have 9 locations. You can check us out on the web at drmichaellange.com or langeeyecare.com. Get into any of our locations. If you've got insurance and you've met your deductible, or you've got a medical flex savings plan or a cafeteria plan and you have to meet those requirements or you lose that money. Let's go back to the phones. Sonny in Ocala, good morning. Welcome to the program.
Good morning, Dr. Lange. I had cataract surgery on both eyes way early this year, and my eyes are still bothering me. I went for a second opinion, and it seems like my right eye is now not focusing where it should be. It goes up into the right, and I have corrective glasses for that now. But my eyes are still bothering me. I can't really concentrate like on reading. If I like to do a lot of reading, I can't seem to do that too much anymore. And it just bothered me. It actually hurt. It feels like the eyeball is hurting. I'm just wondering what else can be done. I really don't want to go for another surgery, but
right.
I've tried the drops. The saline drops or tears or whatever they call it.
All right, number one, first of all, I think you need to get back to see your ophthalmologist that did the cataract surgery and find out why you're having these issues, all right? It's fairly common, Sonny, after cataract surgery for patients to develop a more severe form of what we call keratoconjunctivitis sicca. That's a big word to mean dry eye syndrome. And most pain in the eye really is associated to epithelial disorders, and that means surface disorders of the eye, like dry eyes. So I would say that you probably should try to start using more unpreserved artificial tears more frequently, all right? I like Oasis Tears Plus the best because it has hyaluronic acid in it, which is a natural anti-inflammatory, and I would use that every couple of hours. I would take a good omega-3 fish oil, all right? A triglyceride form fish oil like Nordic Naturals you can pick up over the counter, or the one I developed called Fortifeye Super Omega that you can pick up at any of the Lange Eye Care locations or the Fortifeye website. Even Smoothie King in Ocala is carrying it right now. If you go to the Smoothie King on 27th Avenue and State Road 200, they have the new Fortifeye Super Omega, because that will help with inflammation in the body and the eye and help stimulate a healthier tear film.
The second opinion that my one eye is, for a better term, cockeyed.
Sonny, we got to take a break. We got to go take a break here. I'm going to put you.
Take the omega-3s. I am active.
I got to put you on hold, Sonny. Hang on. And Bill in Ocala, we'll talk about mango seeds when we come back from the break.
Have something you want to ask the doctor? Call toll-free now, 866-977-4820. Here again is the doctor, Michael Lange. Doctor, my eyes, can I see the sky? Is this the price for having
Okay, welcome back to Ask the Doctor. You're listening to Dr. Michael Lange and Dr. Cathy Dau. We've moved the seating arrangements a little bit, so now you can probably see both Cathy and myself. We're all sitting on the same side. She's a lot prettier than me. If you got a question, give us a call, 1-866-977-4820. This is the Wednesday before Christmas, so Merry Christmas, Happy New Year, Happy Holidays to all. 1-866-977-4820, and of course, Happy Hanukkah as well. All right, let's go back to the phones. I think Bill in Ocala. Bill, thanks for holding for the break. Good morning.
Hey, Dr. Lange. I was just wondering if you had touched upon some of the benefits of taking mangosteen into your diet.
Xanthones.
Yes, xanthone, yeah.
Right. You know, that's a great question. And mangosteen is something that we actually use the extract from mangosteen in our Fortifeye vitamins. And that is one of the ways that we were able to get the ORAC value up much higher in our Fortifeye vitamins by using some of the superfruits, the goji berry, the mangosteen, the acai. Those are the 3 superfruits. And then pomegranate and blueberries are near there. But mangosteen is something that's grown, I think, in Asia, in the southeastern part of Asia. And like I said, it's a superfruit. It's called the queen of tropical fruits. And the good thing about it is the xanthones that I mentioned, but also polyphenols and tannins. That typically all 3 of those aren't in any fruit out there, but mangosteen has all 3 of those. And mangosteen, I mean, if you Google mangosteen now, I mean, there's so many different health-promoting properties related to mangosteen. It supports the immune system. It maintains your intestinal health. It helps combat against free radical damage because of the ORAC value. It's been shown to help support joint functioning, cartilage functioning for the arthritics. And even some studies I've seen actually show that it may promote respiratory health. So I think a lot of this is all related to the very high antioxidant power. Now the crazy thing is, Tufts University Center for Anti-Aging has not, I've looked on their website all the time to find out if they've actually verified the ORAC value of it, and I cannot find a verified ORAC. I've seen some things that people are saying, some very high ORAC values, but we've got a verified ORAC value for goji and for acai and for green tea, but I haven't found one for mangosteen. I've seen it anywhere from 7,000 to 150,000 ORAC value for 100 grams. So I'm still searching for a really scientific ORAC value for mangosteen. Now, why do you... Go ahead.
Of course, the body can only absorb so much of the ORAC properties,
Right.
You know, in a serving or whatever. So going overboard might not really help you too much. But what I found for me was, since I work outdoors and you know, labor or whatever, is that you know, as I'm getting closer to 50, the aches and pains, you know, that where I normally would have to take like anti-inflammatories, that when I take this product, the only way that I can find it is in a whole fruit juice type of a setting. That it excuse me, that it reduced me having to take any of those properties.
Right, right.
You know, any of those products, if I could take it in the natural form.
Right, I think that's a good idea. A lot of the mangosteen products out there, you do have to be a little bit careful because there's some good ones out there and there's some that are just trying to get on the money-making bandwagon. So you got to be very, very careful with some of those mangosteen juices. Some of them, you got to look at the ingredients, are filled with a lot of sugar and a lot of fruit juice, like grape juice and cherry juice and things, and they have very minimal amounts of the actual mangosteen. So when you look at the back of the bottle, it might say filtered water first. The second ingredient should be mangosteen. And not, say, grape juice or something like that. So check that out. But I think there are some good products on the market, and I think mangosteen is something that is being studied a little bit more carefully now. And I think the jury is still out because I haven't seen a lot of great studies, double-blind, placebo-controlled studies for the eye and total body yet. But I think they're going to be emerging very soon, and I think everybody can benefit from the mangosteen. So thanks for that call. All right, take care.
If you're ever close to an Asian market, you can find fresh mangosteen, and a lot of them, I've been eating them since I was little, and I never knew how, you know, it's now kind of the cool thing to do, and I never knew what the English name was. I just know what it is in Vietnamese, and
what is
we've been eating it. So
what's it called in Vietnamese?
You put me on the spot, and now I forgot. But a lot of these tropical fruits, I can recognize the Vietnamese name, but anyway, the mangosteen is really good. It's when you crack it open, it's actually a real white meat, and it's like an orange taste, but then the texture is a lot thicker, like a pulpier meat.
Do you peel it? How do you open it?
You kind of have to just cut it. It's got a real thick skin on it, and then inside is just this bright white meat, and inside the white actually has these big black seeds in it too. So be careful if you do eat them.